name is Dr. Mallory McLaughlin. I'm an assistant professor of optometry at the Illinois College of Optometry. I'm also an attending optometrist at the Chicago Lighthouse. Most of my time is spent in the clinic, medically treating patients with glaucoma and other eye diseases, but I also perform clinical glaucoma research. Approximately 3 million Americans have glaucoma currently, and it is estimated that more than 7 million Americans will have glaucoma by the year 2050. Glaucoma is one of the leading causes of visual impairment and blindness in the United States. It disproportionately affects Black Americans, affecting 6% of that population over the age of 69 and 12% over the age of 80. Early on in the disease process, the patient is asymptomatic. If the disease goes untreated over many years, the patient slowly loses peripheral vision until they develop tunnel vision and sometimes permanent blindness. Because symptoms typically don't occur until the end stage of this disease, it is estimated that half of people who have glaucoma are unaware of their disease. While there is no cure for glaucoma, vision loss and blindness can be prevented in many cases when it is detected and treated early. Glaucoma is diagnosed and monitored with peripheral visual field testing. The gold standard visual field test requires the patient to sit upright and hold their head still on chin and forehead rests inside of a large bowl-shaped instrument for up to 12 minutes. Small dim lights flash inside of the bowl in the patient's peripheral vision, and they press a button when they see a light. This test creates a map of the patient's peripheral vision loss that the doctor can monitor for progression of their disease. In my clinical practice, I observe that this test is not accessible to all people. Those with limited neck and back mobility, users of wheelchairs, or those who must lie flat on their back cannot complete visual field testing because they simply cannot sit inside of the machine. This makes their diagnosis and treatment much more challenging. Several virtual reality visual field tests have recently been developed. These devices are head-mounted, allowing the test to be performed in any comfortable position, increasing accessibility. Patients could complete this important test in their wheelchair or in a hospital bed. Those who have strokes may also have loss of their peripheral vision on one side of their body. Those patients could be formally evaluated for vision loss bedside in the hospital with this device. Because the virtual reality device is portable, the test can be performed in any room of the clinic, improving clinical efficiency. It could be used on mission trips or on eye health screenings in American communities that do not have access to medical eye care in reasonable proximity to their home. This technology could be thoughtfully expanded to allow for home monitoring of glaucoma. These newly developed devices need to be clinically validated to ensure that the test results are accurate and repeatable. We performed an independent validation study on a commercially available virtual reality visual field test. We compared it to the gold standard visual field test with the goal of determining if the virtual reality device can comparably detect vision loss from glaucoma. Because all study subjects were required to wear face masks during testing due to the COVID-19 pandemic, the study also examined the effect of fogging due to face mask wear. We found that lens fogging significantly impacted the results of the head-mounted virtual reality device. We plan to conduct the same study in vaccinated subjects not wearing face masks to get a more accurate comparison of the two devices. We will perform the same test on multiple visits to determine if the test results are repeatable. With the rising prevalence of glaucoma, development and validation of technology to increase accessibility and availability of glaucoma diagnosis and management is imperative. Thank you for your time.